This is Mile High.
Do I want to tell the story or do I want to show the message?
You've got a lot of work to do between Mile High.
The time has come where we can know
we have a responsibility, an ethical and moral responsibility.
We have to do it better in order to move people along.
Up, down, inside out.
If you get your mind right, it is not. It is a receiver of thought. Because love is my first technique.
it's now time for the show.
Dr. Daniel Knowles here for the Mile High Podcast. Thank you for joining us. Wherever you are watching or listening, whether it's Spotify or iTunes or YouTube, make sure you hit subscribe so you never miss any Mile High Tick. And you most certainly do not want to miss Mile High 14. Oh my God, I can't believe it's 14 years. All right, and it's August 20th, 23rd. RiseUpToMileHigh.com is where you can get the details, and you and your team can join us. And our guest today, Kate Rufolo, is one of my favorite people, and I'm so thrilled that she is going to be joining us at Mile High 14. She has worked in risk management consultant with ChiroFutures. She practiced for 33 years. She graduated from Penn State, 91 grad, and she was the first female president of the PCA, and so thrilled to have her. She was a board review instructor for Irene Gold, and this is going to be a lot of fun, this episode, and it's also going to be even more fun to have her on higher ground. Thank you for joining us today, Dr. Kate.
My pleasure. Thanks for the invite. Absolutely.
Well, we're thrilled to have you. And you know what? Before we dive deeper, I'd like, there's many people that know you, but there's a lot of people that don't. Can you let people know how you found yourself into this chiropractic world?
Oh, that is a funny story. I actually had never seen a chiropractor. My mom was seeing a chiropractor, and I was in college and I was studying pre-med, wasn't sure what I wanted to do, was thinking pediatrics, and I had a very interesting counselor because back then you had to get a recommendation to apply to med school. And my counselor told me I had the heart, but not the brains to be a doctor. So He would not write me. Yes. And that was before Me Too and all of that. And I didn't know I should be upset. So I thought to myself, oh my gosh, now what? And my mom had introduced me to her chiropractor. And so I actually turned up the first day at Penn State, and I had never been adjusted. And our spinal physiology professor and our x-ray professor, Dr. Joe McQuate, basically asked the rhetorical question, has anyone here not been adjusted? I raised my hand. I was the only one.
Really?
And oh yeah, I was the only one who had never been adjusted. Only one. So he said, okay, well, you're going to get adjusted. And I said, no, I think I'm good. I'll be fine. And he wouldn't take no for an answer. And it was a phenomenal adjustment. And he was a big guy. He had no neck. And it was funny. I wound up being the only student intern he would let adjust him by the time I was done.
Wait, what was his name? Who was it?
Ready to graduate. Dr. Joe McQuate.
McQuate. Okay, I don't know the name.
Mm-hmm.
But that's so, it happens more and more now, interestingly. There's more and more people that go to chiropractic school that have never been adjusted. I think it was less common in the past, but it's interestingly more common now.
Yep. Never looked back though. Fell in love with it, fell in love with its purpose. I'm somebody that likes the science to make sense. So I'm pretty good with almost anything if I can logic the science behind things. Mm-hmm. And it made sense to me. And so I was off and running, and then my husband and I started a practice, and I wound up getting involved also in the politics of chiropractic. So I've done that for almost 30 years as well, in addition to the instruction and then just the practice. So I've seen every side of chiropractic.
Interesting.
in
We're going to have
rumors.
fun
Yep.
here. So actually, let's go back to Penn State. Can you share anything
Okay.
with people about what the experience was being at Penn State at that time? So we're thinking late 80s, early 90s, right?
So it was, we were in the basement of one of the oldest colleges in Germantown.
Okay.
So we had a central area with a couch, and that used to be where basically the entire school would get together in the mornings and have coffee. And let's see, Joe Strauss was my philosophy instructor for all 10 trimesters. Um, we had Reggie Gold come in and talk. We had Arnaud come in and talk. So we had all, you name a name, and they were there. I even think Donnie was in, and came to talk to us because there was not a big school.
Right.
When I graduated, there were 7 of us, and I was the only girl in the class.
Mhm. Interestingly.
Hmm. Yep. We didn't have accreditation when we started out. By the time we were done, we were accredited with SCASA at the time, and we were able to sit for 26 states. So I grew up in Jersey. Funny thing is, I can't practice in Jersey and I can't practice in New York. But luckily, I met my husband in chiropractic school, and he's from Pennsylvania. So it worked out perfect.
And then you practice. Where did you practice?
We practiced here in Schuylkill County. So we're right in the central part of the state. I can get to Harrisburg in 45 minutes, Reading in 45 minutes, Allentown in 45 minutes. So we're dead in the center. If you ever had a Yingling beer, that's where it comes from, in Schuylkill County. So we just started to practice. It's very rural, physician shortage area. So when we started practice, we were seeing people for kind of everything because they didn't have a lot of doctors. And the funny thing is, a lot of the medical doctors were also starting in practice the same time. So we
Mhm.
all grew up together. We were all very close. They would send patients to us. They would be patients. We could contact them when we had issues. It was really a wonderful way to practice, to build a practice. And, very, like I said, rural, very blue collar. They still have Halloween parades here. So your patients became part of your practice forever. I had 1 day olds, I had 100-year-old, and I had all of their family in between. And by the time I left practice, I still had some of my original patients.
That was a very special time to be at one of those three schools, Sherman,
Hmm.
Penn State, ADIO, and also
Yep.
Southern California
Yep.
State. I think that was its name at that time, if I'm remembering
Yeah.
right. It was, so, I
Hmm.
think it changed names at different points, but I remember it as
It,
being
it
Southern
did.
California State. Okay. But those, being part of those three schools, we felt like there was we were connected and that we were part of like
Hmm.
this mission and that like those were our sister schools,
Yep.
and I remember I went to I won't say what school it was, but I was checking out chiropractic schools just to like double check that I really want to go to South Carolina after
Hmm.
being a New Yorker. And and living in Greenwich Village, could I live in Spartanburg, which was like a big jump. And I went to some other school, and at the admissions, I was just talking to them, and I said, well, I'm thinking about going to Sherman. The person actually said to me, "Oh, you don't want to go to a SCASA school." And that was the thing. I said, "Okay, well then I'm not going here." Just because they said that, it was like, no, actually do, because I want to go to school that teaches chiropractic, and the other schools, as we know, we're not doing as good a job at that. So I really
Right.
felt like part of that. You guys were part of our family in that. So
Yeah.
yeah, and so then you got to later on be part of teaching there, right?
Yes. Yes. I So Steve Marini
Mhm.
was the dean of the school, and he used to teach microbiology and all the physiology. And we were buddies, and he was like, you should teach for Irene. So I started teaching for Irene, and then when he became full-time dean, he said, well, I need someone that can come in and teach physiology. And that was my major in undergrad. So I stepped into all the physiology courses. I stepped into the ortho neuro and the diagnosis courses. And as a matter of fact, the first time I ever taught for Irene, I was at Parker. I had graduated 3 days earlier, and I was in front of 800 students between Parker and Texas Chiropractic College in an auditorium, and introducing myself as Dr. Kate Rufolo, and had the worst case of imposter syndrome ever, because it was like, God, I hope they don't know I just graduated. And I'm up here teaching them how to pass part 1 and part 2.
So then you
But
have the
yeah.
experience of you've taught risk management, clinical management, coding, and documentation for
Mhm.
decades now.
Yes.
And it was stepped into that. I gotta ask, um, during that time, you've got to have seen lots of things, probably
Oh,
lots of
yes.
crazy things and things you could not imagine. And most
Hmm.
people think are, and maybe even things that you see like, you see this pretty common. Field doctors think, well, that would never happen, but you see things like that monthly. What is something that you would want, chiropractors, whether they be new grads or to know or be aware of that they may not be aware of?
I think we get so caught up, and there's nothing wrong with it. It's part of the process. We get so caught up in wanting to teach the patients what chiropractic is, and be good and be congruent and just be good chiropractors, that we forget that we're still doctors.
Hmm.
And I see most of the issues that happen is they forget that initially it's all about patient safety and making sure that it's okay to move ahead with chiropractic for your patient. Now, does chiropractic benefit everybody? Yes, but not everybody belongs in a practice at that moment. And we're seeing a lot of times doctors are taking patients that just are a hot mess, or we're seeing a huge increase in stroke. And it's not that chiropractic causes it, it's that it's already in process. And the doctors are not paying attention to the subtle things. So for me right now, that's the biggest thing, is to remind the doctors that, nobody ever walks in and hands you the key to their Lamborghini, right? Or their stock portfolio, but they come in and they hand you their baby. They literally put their head in your hands, and you owe them that bit of making sure that your full concentration is on that patient at that moment, and that everything is good to go forward, because then you can have a patient for life.
And I think that is a mistake that many times, and correct me if you disagree or if I'm wrong, that many times those in the subluxation adjustment area may not take as seriously as they need to. In other words, looking for
Yeah.
warning signs or something like
It,
that.
it's it's true, and I've gotten probably the most pushback from especially some of the older subluxation based doctors, when I tell them, it's okay to ask questions. It's okay to take a blood pressure. It doesn't mean you have to treat what's going on, but you have to be aware, and you have to make sure that the patient is where they're supposed to be. And that is not about trying to treat. That's not about trying to do more than you're supposed to. It's just simply patient safety. And after COVID, nobody is healthy anymore. We can have a discussion about vaccines, and it's not even about that. It's really about the virus and how diabolical the virus was, and the damage that it perpetuates. So we can't kind of fool ourselves into thinking that it's safe. It's not that it isn't. If you miss it, then it's a problem. And I hear all the time too, well, I used an instrument, or I didn't do like a hard manual adjustment. But again, you're the doctor, so you're supposed to pay attention.
Well, and this is a good point. It's a very important point. They made a big point of this at Sherman College in terms of my education for patient safety and things to do relative to patient safety. Tom Gilardi was big on that, and the whole education had a big focus on you discerning what it is that you're doing, what you do and what you don't do, and that's being part of your intake, like a terms of agreement and those kinds of things. Yet at the same time, people may not learn that at other schools, and maybe not as stringently, and then think, well, I'm just not responsible because I'm not treating anything, and that's not true. And also discerning whether you're treating or not treating something, because some people practice chiropractic, sadly, in an allopathic model, and they're not, and they're saying I'm only adjusting subluxations, but they're telling them that they're adjusting subluxations to treat their headaches or something like that. Right. And that's the very thing to be clear on. So let's hit one thing first then, because I'm glad there's this topic for primary care, being a primary care provider, right, versus portal of entry. Can you help our audience understand that discernment?
Yes. So primary care means you are responsible for evaluating and taking care of the issues that you find, whether it's a referral out or you're treating it with medication or whatever you're going to do. Primary portal of entry, which is what we are. We are responsible to make sure that it is safe for the patient to move ahead with chiropractic care. And the reason why we're portal of entry is no one has to write a script for a patient to see us. So they can walk in off the street. Because they can walk in off the street, you're going to see a lot of things. Somebody's headache could be something more than that. Somebody's, pain in their low back could be something more than that. And it's up to you to make that determination. Is this actually something associated with the subluxation that I correct the subluxation, their body is going to do what it needs to do? Or is this something more insidious? Are we looking at cancer? Are we looking at a stroke? And should they be somewhere else for right now? And that's really the discernment of the two. You're not treating it, but you're still tasked. And because doctor is in front of our name, and the way all the licenses and scopes of practice are written, this is part of your responsibility to maintain your license to be doing this.
Right. And this is something that people get unclear on, or they see someone without doing any kind of workup or any kind of history. And when they say, but I'm only correcting subluxations, well, you still have a responsibility to that patient to do an appropriate intake of some kind relative to your jurisdiction and so on. And that doesn't mean that you are treating the person. It doesn't mean you have to differentially diagnose, right? But you have to be, as a person that's seeing this person without a referral, see if it's safe for you to do care. And I'm sure you see that as a mistake more than I want to know.
I see it a lot. I will say chiropractors are fabulous on new patients. We're great. We hit all the buttons with the new patient. The problem we have is when we get into our wellness care and our maintenance care, that we tend to not really talk to the patient about what's going on. If they always had neck pain, it's just the same neck pain. It might not be the same neck pain right now. I'll tell you that, the strokes that we're seeing, they're 95% of the time, they're maintenance and wellness patients. And nothing, no intake was done. And, if you're seeing a patient, you haven't seen them for 3 weeks. If you don't ask, you don't know what went on in 3 weeks. Did they fall down the stairs? Patients are, I used to say, my favorite TV doctor was Dr. House, right? And patients lie. And a lie of omission is still a lie. And if you don't ask a patient, what went on, or, hey, you said you were dizzy last Wednesday. If a patient isn't dizzy when they come to see you, they're not going to tell you they were dizzy last Wednesday. They'll chalk it up to allergies. It was, whatever. But that can be an important puzzle piece for that patient. Right. And so that's my goal right now, is to get chiropractors to pay a little bit more attention to their maintenance and their wellness patients.
Huh, that's interesting. I did not think of it that way, that'd be where you'd see more of that as compared to intake. And some of the intake, and again, if I'm not right, tell me, but is, being triage of like that you need to see someone about this now, you need to go in an ER, you need to see another healthcare professional before we take further care.
Right. And that's also something that chiropractors, I think, are afraid to do. They worry that if they say to the patient, you need to do this first, the patient will say, I'll get around to it. But then if you don't put your foot down as the doctor, and again, you're the doctor, be the doctor.
Right.
And that's what I see a lot of right now.
Yeah, and I see a lot of it because, as you know, I teach technique programs, and seeing people that don't know how to do what you just said, or just not realizing that that's actually important. You can't just lay down and do whatever your analysis or technique package is. You have to take them in as you're being their doctor. And it's painful to see it, because you've got to say, well, you got to take responsibility for them as you're providing care for them. So, something that, as you said, Reggie Gold would speak often at your school. He spoke at Sherman all the time. And I know I would, if I knew he would speak, I would drive 3 states away. Many times we drove as students wherever he was, and we wanted to hear him. He went to do assemblies, and he actually came to my office opening. Reggie Gold came to my office opening in South Carolina. I've got the book where he signed in. He said often, chiropractors are wanting to do diagnosis, or saying they can do differential diagnosis, but they don't have the tools of diagnosis at their disposal. So then they're dangerous if they're taking care of that differential diagnosis area, and they don't have the tools to utilize. Right. Exactly. And versus saying, well, I'm not going to take responsibility of this, other than making sure you see the right person and get the right tools that I don't have access to, versus saying, oh yeah, your headaches are caused by C1, Right. And it's not it doesn't take anything away from you as the chiropractor to be able to direct your patient, whether it's a direction for your care in the office, or it's a direction for, hey, we're gonna pause for a beat here, and I need you to do this first. Right. Absolutely. And that's kind of I think it's a lost art anymore in chiropractic. Why do you think that is? I think we got so incredibly caught up with the ease of practice. Now, I'm not saying practice is easy, but when we moved well into the insurance age, and you had your choice, you either went all insurance or you were all cash, right? And it kind of helped disconnect you from a lot of processes, right? Because you were getting paid, you were seeing your patients, and I think there's a sense of complacency that happens. You're very full of everything when you graduate.
And then as practice becomes more rote, I think we get complacent. And I think that was part of it. I think, unfortunately, now, I don't know that they're learning as much as they should, or if they're retaining the importance of it when they get out. And we don't have as many mentors as I think we used to have years ago when you and I started practice.
Yeah, I hear that, and I think that's true. And actually, that's part of why I put on Mile High, to be honest, is that I felt like there needed to be a hub in the center of the country where there was a resource of people hearing some of what I didn't learn in school, and subluxation adjustment focused. And for people that maybe didn't get that in their chiropractic education, for whatever school they went to, that they can, get at least connected to people that are hear things that they did not hear in chiropractic school relative to that. I got to tell you, relative to your answer, I don't think it's true. And also, I think there's another reason. My take on it is it's lack. It's lack and fear, because people are afraid to lose the patient. So they've got let's just get them on the table because I want them to be happy. So I want to adjust them right away. If I make them go get an x-ray or make them go to the ER, they, or whatever it might be, they'll think I'm not as good a doctor, or I might lose the patient.
Yeah. And that is huge. And I have said to some of my doctors too, said, chiropractors are not, they typically don't say no, right? Back when we were in school, it was numbers, right? You had to have so many numbers to get through clinic. Clinic has improved over the years where it's a little bit more the whole process of everything. But back when we were in, you had to hit your numbers.
Right.
And then when you got out of school, a lot of the practice management was about the numbers.
Right.
So you certainly don't want to turn somebody away, because that goes completely against the very process that you were kind of taught. And I tell patients all the time, doctors all the time, I'm like, if a patient won't do what you say, what makes you think your chiropractic care will be effective? Right? A non-compliant patient is a non-compliant patient.
Right.
And that means they're not really getting the benefit of what you're doing anyway.
Right. And then they let the patient run the show.
Exactly. And that really defeats the purpose, the whole purpose. You want the patient to be educated and to be a part of the process, but not where they're telling you how it will be.
Right. And I think there's some aspect of, you used one of my favorite words, which is process. There's some aspect of people losing sight of the person's healing, their care being a process versus, I adjusted them and it's an event. Well, you need a sequence of adjustments so their spine to continue to up level. And people, they learn chiropractic as a fixing the person, that then, we know it's not fixing a person, but, they learn that as like, I've got to do the adjustment of L3, but no, it's that the visits build on each other for the person to get to a certain outcome of a healthier spine and nerve system. And I think there's a loss of that, versus, I just got to get it once because I'll get money for the one visit or something or whatever it is, versus that I'm taking this practice member in to help them grow in their health and vitality and such.
Yep.
And then
that's where we're at right now.
Yeah, I see it all the time with new grads, and they just don't get that. Well, wait, what do you mean health is a process? I learned physiology. This is how I do C5, but then, it's not what you do to C5. It's you making a care plan and recommending something, and then like mile markers checking their progress. And that's missing in new grads.
That is a lack of an ability to communicate. I think the new grads understand chiropractic. They just cannot communicate. You can't have someone walk in off the street because you're going to get what? Like 2% of your patients in your lifetime that are pro chiropractic know all about it. You don't have to tell them anything. They can probably tell you, right? The vast majority don't really have a clue. And you have these young grads and their communication skills to be able to look at the patient and say, okay, I hear where you're at right now. This is my approach. And this is how we're going to work to get to where your goal is and the ultimate goal is. It's not about selling them on chiropractic lifetime day one. It just that doesn't happen. And that, I think, is part of where we also get lost with the making sure that you're going through that safety process and that intake and that, okay, yeah, you're coming back. Is it still okay for us to move ahead? What's your body doing right now? What's your body telling us? And that's I think that communication is a lost art anymore. And I don't think I think they're trying, but I don't think the connection is there.
Well, and part of that loss of connection is people thinking of chiropractic as glorified physical therapy rather than actually, their nerve system and increasing their healing capacity and such. Now, you ended up with ChiroFutures. Tell a bit about your work with them.
Matt McCoy and I met on Facebook, and we would have some great discussions. I came from a different side of chiropractic than Matt does. He used to refer to me as the queen of the cartel because I was the president of COXA. So we would have some conversations, but we always managed when there was a question about what to do next, and we were talking about clinical management and risk management, we always were like dead on eye to eye. And when I finally decided I was done with practice, and part of that was my mom was suddenly diagnosed with lung cancer that had metastasized to her brain. So this was after COVID. I was driving to Jersey 3 days a week, trying to practice 2 days a week, running my mom's everything and consulting with all the doctors. And I was exhausted. And my husband looked at me and he said, he said, Katie, I think it's time. And I had said something to Matt because he had me do a few things for him. And he said, yeah, I think I'm done. He said, your brain is too big to waste. He said, so why don't you come with us? And then I started working with them. I'll be starting my 5th year with them. And I am, the consultant. So if you have a question, I'm usually the person you're going to talk to. I teach for them. I create courses for them, and I'm their resident stroke expert right now.
Pretty interesting for the person that didn't have the brain to go to medical school.
Right? I often wonder whatever happened to him.
And what do you...
Yeah, I still...
Go ahead.
Go ahead.
No, go ahead. What were you going to say? You still...
I turned out I did actually have the heart and the brain to be a doctor.
So what do you love and appreciate about ChiroFutures?
I had even when I was in practice, I had all the other insurers. I was NCMEC, I was Princeton, I was OUM, and I actually went with ChiroFutures about 10 years prior to when I retired. And what I loved about them was I could talk to someone. They were reaching out constantly with, hey, you're not alone. If you have this, there's so many times you'll have a moment in your office, right, where something doesn't feel right. I refer to it as your spidey sense, right? ChiroFutures tells everyone, You got that? You call us. We'll do an incident report. It's, it's not going to count against you, but at least we're here with you and we can advise you. And I never had that with any of the others. I was on my own, until such time that I needed an attorney. And ChiroFutures also is really one of the only ones out there that's actually for chiropractic. Like, they are protecting the practice of chiropractic. And that's huge in a day and age when, we're such a small piece of the pie anyway, and everybody's looking for the, like the next way to make money. They're still there supporting chiropractic.
Mm-hmm.
And doing it well.
Right. I really appreciate that about them. So, and I appreciate you being part of that as well. So, you said, and I think you alluded this as we opened this particular interview episode, the most important patient is the patient in front of you. I think you alluded that in the first couple of minutes here, but you said how that's one of your favorite things to say or point out to people.
Yes.
Why is that so important?
Because we get caught up in everything else, right? You're caught up in your EHR charts, you're caught up in the drama, what's going on with your kids, the front desk, noise outside, the phone call you have to make. And we tend to shortchange that person who's in front of us. And if you go in to that room and you are actually just there with that patient, and you are listening and you are communicating and you are working with them, then everything you do will benefit that patient. And then you do that with the next patient and the next patient, and try and get out of the, million and one other things you have to do. And it's hard, but if you can make that patient the most important in front of you, you're not going to have to try and find new patients. You're not going to miss things with your patients. You're going to have a connection with that patient, and they're going to connect to you.
So important. So important. And, one of these reasons why I think our Rochelle and my practice thrives is doing that. Because a lot of people don't listen to their patients. I know you're going to be talking about this at Mile High, and I'm so thrilled you're going to be there this year. And I know you said you're going to be talking about this there, but that conversation about stroke and chiropractic, it's something you see in the news, you see something in the public, and there's the stories about it and the fear about that. What would you like to share now, not taking away from your thunder at Mile High? What would you like to share about that now?
That first and foremost, chiropractic does not cause strokes. It does not. There is no causation. And I can tell you that no one else believes there's causation either. And I say that because when I do a lot of my research for malpractice, I go to the lawyer sites. And of course, I gave birth to a lawyer now, so that makes me almost technically a lawyer as well. They are even saying it's that we're missing things, that there is no proof, and they've looked at cases, and they found that they can't make money off trying to prove that it caused the stroke, but they are making money because now they're calling it a failure to diagnose. Right. So I want doctors to understand that it's not about your technique. It's not about your philosophy. It's not about, how you did what you did. It's about paying attention to that patient when they walk in, and not missing the important signs. And that's really, honestly, in all the cases that I've consulted with and the cases that I've sat as an expert witness on, that is usually the issue. It's not that the doctor caused it. It will change the doctor's life if it happens. There's no way to go back and feel comfortable doing what you do if it happens. But, you've got to start paying attention to it and
Got it.
and being aware that it's out there. And that's that between Amy Haas and I, we sat one night on my patio over a lovely grilled dinner and a bottle of Pinot Noir, and had just one brain cell moment about the spike protein and chiropractic, and she's truly my brain cell soul sister.
Well, it's good that you'll both be at Mile High this year then.
We are very excited. We are
That'll
very
be
excited
really
about
good
that.
topic matter. Actually, she's speaking at our philosophy night in a couple weeks too. So, but this will be good, and that's why I decided to put together that, especially for the people that have subluxation as the center point, or their heart and soul of their practice, that they have a resource in both the Mile High podcast, but also in, live event, that they can be able to hear from people like you as well as Amy. So, I'm really grateful to be part of that this year. Is there any last thing you'd like to share in this particular episode before we wrap up?
No, I think if everyone can just start thinking a little bit about some of the things I said, then we'll be able to dive right into it when I'm out there in August.
Well, we're really psyched to have you there, and tell everybody. Telling everybody who's here, make sure you dial in, clear off your calendar, August 20th at the highest altitude party in chiropractic, and it's going to be incredible speakers. RiseUpToMileHigh.com. You want to be there, so make sure to clear your calendar, bring your team. And you get the 411. I don't think you can say 411 anymore. I don't think people know
I don't think
that
we have
anymore.
that
I think you and I know it, but people don't know that anymore. So now somebody's going to Google or AI 411. What is it? Because we talked
That's
about it,
right.
because no one else knows what
They're
it
going to
is.
find out how old we really are.
Yeah, it's like not knowing what 6'7" means, right? So hey, we can pull that on you. We can say 411, and you don't know what that is. So,
That's right.
But RiseUpToMileHigh.com is where we can get the details. We look forward to seeing you on higher ground, and honored to have you there. And everyone, keep changing spines, lives, and minds with chiropractic.